So Lina is doing a pitch talk. So a pitch talk is an idea she's working on but hasn't yet developed to a point of doing the work or being able to present results or anything like that. And she gets a chance to spend 5 minutes or so telling us about that idea, and we get a chance to help her with that idea for about 10 more minutes after that, which is just such an awesome thing to do. And I really hope you get a lot out of it, Lina, and we really appreciate that you're doing it. So I'll just hand over to you. Thank you.
Hi, everyone. There, of course, yeah, sure. Thank you. Hi, everyone. I'm Lina. I'm a medical educator with NTGP in Darwin. And the research idea or question that I'm going to talk to you about today reflects a real-life problem for some of our registrars at NTGP. In the last 3 years, we have been training increasing numbers of international medical graduates or overseas trained doctors or registrars. And for some of these registrars, they seem to have significant problems with their spoken English language skills. And we've been getting feedback from supervisors, clinic staff, patients, and medical educators about the language skills and the communication of these registrars. And it's often reported as a significant challenge in training the registrars. And we know now, when looking at the literature, that these registrars seem to have problems passing the exams as well, but that's not what I'm going to talk about. So with this problem, we just felt that there's something that needs to be done about it, and someone suggested an online training program. It's a pronunciation program that runs for 15 weeks, and it mainly works on accent reduction. So you're not going to sound like you were born in Darwin, but it's just to make it a bit easier to understand and facilitate communication. However, we only had 6 registrars opting to do the training. And the ones that we identified as most needing the training did not want to do it. They did not want to join. And the registrars, and you can see that, some of them completed the training, some didn't. But even the ones who completed the training, and I know one of them did it twice, we haven't really noticed, and that's just a personal reflection. We haven't noticed any substantial changes in their communication or improvements in their language. Okay, so being an IMG myself, and I have to declare my bias, I just felt like I need to look at this and try to think about what can be done about it. And it just seemed to be, the first logical step is to actually look at this program in, a systematic way and see if we can change things. And looking at the literature, all the alternatives to improve, the linguistic part of communication involve things like employing a speech therapist or a language teacher, and sometimes it's just sounded very resource intensive. That involved a clinical teacher or a medical educator with the language teacher or the speech therapist. And for us as an organization, that's not as feasible as doing an online training. So what I'm suggesting, and this is where I need your help, is a small-scale qualitative study to evaluate the program. And the way that I'm thinking we can do it is to invite some registrars to do it, but actually talk to them and their supervisors, and maybe a medical educator who knows them, or clinic staff, and ask them a few questions, which I'm going to show you in a minute, and then meet them halfway through the program and after they've done it. And these are the questions that I'm thinking we should be looking at. So whether it does actually is just all self-reflection from the registrar and their supervisors and the others that might be involved about whether it actually made any difference. Did they perceive any changes in their skills? And if they did that reflect on the way they practice, their comfort in consultation or their confidence? Because again, when you speak to these registrars, most of them have insight of the communication problem, and it just affects the way they consult with patients. So, happy to take any feedback or questions, but the 3 specific questions that I've got for the audience is this a problem for your registrars in your organizations? And question 2, are you doing anything? Have you tried anything in the past? And I met with one of the medical educators yesterday from Victoria, and he mentioned something, we didn't have time to talk about it, but he mentioned something that they tried in the past. And the third thing, if you think that these are the questions to be asked, if this is the program that we're going to evaluate, is this where the money is? Are these the questions that we should be asking?
Thank you, Lina. Do you want to go back to the previous slide with those questions? So if anyone has knowledge in the area, can answer her questions, knows someone else who's doing work on this, or can help in any other way, stick your hand up and we'll get a conversation going. Great. There's a couple of people right at the back here ready to help you, Lina.
Thank you, Lina. This is absolutely a problem. And I have often wondered, what can I do? Because I've had a lot of registrars and I had a lot of patients that come in and say, I can't understand she's lovely, but I can't understand her. So in terms of when you get around to evaluating, ask the patients is really important, because they do, they clearly have problems. The only solution that has ever been tried, because I haven't found a solution, except mainly to try and get them to talk slower and to feed back to them that people are having trouble, which means they just have to try and explain things and ask them, do you understand me? Can I tell you in a different way? I think that's a great thing to try. I'd love to see the results. I have had one registrar that did go to a speech therapist, but I didn't perceive a lot of difference. I'm not quite sure how often she went.
Do you want to have any conversation, Lina, with that before I take the microphone away? Sorry? Do you want to have a conversation with her about any of that before I move the microphone? Is there anything you want to say?
No, I'm happy. Yeah, thank you. It's just like things that I would suggest, and I think things that I heard about it, if you want to try it, because it seems to be a problem for you, is one clinic in Alice Springs gave that registrar a homework, and the homework was to watch Home and Away every night for the whole term. And according to the supervisor and the ME who visited the registrar on ECTDs 2 times or 3 times, it actually made a difference. Yeah.
There you go.
Yeah.
I've heard Hilton tell me watching MASH is useful. I've never heard ever of Home and Away being useful.
Hi, Lina. Hi, Lina. My name is Ulatanga Dubini and I'm a GP supervisor from Sydney. Thank you very much for taking up the project. That's an excellent thing to do. In Sydney, I also wear a hat as an examiner for the college. And as an examiner, we deal with a lot of, when we're doing our training for the exams, for lots of different types of registrars that come through. So I take the challenge up with the college. Have a look when the candidates come in, and you can identify from there and suggest it to them, and then see if they will take it on board, because some of them come from very remote areas. They come in for the training, and we're like the last resort. We're just about to set the exams with them, and they're struggling with comprehension, studying with the format of the exams, and in the end we want safe, unsupervised doctors. So I think it's important that we look at all different levels that we can examine it, and I'm very privileged that you've taken that up, and I'd support you on that project.
Anything you wanted to say while I move the microphone around, Lina?
Yeah, I just want to say that, I examined for the college, and it's sad to see some of the registrars come through, and it's just surely someone along the way identified that they're not going to pass, because it's very hard to understand them. And you think that someone, I don't know, yeah.
Lina, Margaret Simpson from GP Synergy in Sydney, and likewise I'd like to thank you for taking up this challenge. Just 2 points I just wanted to highlight. One about, sometimes it's not about the communication as far as their language, it's about the speed in which they talk. If you can slow people down, you can comprehend what they're saying. But it's also the two-way street that sometimes the registrars just don't get or don't understand what the patient's saying to them. They haven't been Aussified enough, and I guess that's your point about use of home and away. But thank you.
Thanks, Lina. I've just got a couple more, a couple here and then over there, so it's going great. For you.
I just want to comment on that. Funny enough that when you review the literature, that it seems that, and there are studies from the US and the UK and here, but it seems that the registrars, well, for that study or a couple of studies, that they always blame the accent, the local accent, rather than the English as second language. So.
Hi, Lina. I'm one of the I'm the regional head for Sydney South, and I've been running study group sessions for registrars who have failed the OSCE, and a lot of these registrars are IMGs who have struggled with language and performance. So initially with the sessions, we got people who would coach them in language and performance. There wasn't much of improvement in the pass rate. I then tried University of Sydney. They have a Centre for English where it was one-to-one coaching. Again, not much of improvement. A lot of the registrars took on the feedback and made a few changes, but I think they also felt that they didn't really have that much of a problem. When I looked into it in depth, they did have a lot of problems understanding questions, and they took a lot longer reading the questions. So again, they wouldn't finish like the AKT in time because they didn't understand. But when you kind of talk to IMGs, they feel quite insulted when you say that their English is not up to scratch and therefore they can't. So again, emotionally, how they react to that kind of feedback and accept it is one of the problems. Some of them have lack of insight, and therefore again they don't want to go in that direction, and so they need to recognize that that is a problem. Thirdly, I think who we use to coach these registrars also need to be aware of the situation, and they are kind of trained in coaching doctors, and some of the doctors are experienced. They are specialists in their own country and then they come here, and again with each culture the kind of the accent is different, and so the way the coaching is done has to be different. So in the sessions which we have done, we have had Graham Lee, who's the director of training. He has done some sessions where about how to roll your tongue with patients who speak Mandarin. I've worked on registrars who speak Indian dialects as to how to change their accent. There has been slight improvement, but again we've struggled. So I think if you have an online course which is specifically targeting, that's great, and I would definitely support that.
Lina, I've just got in front here Genevieve and back to Marissa, and we'll probably use up our time with those, but we'll do those three and see how we go. If you wanted to comment before I pass it on.
A previous RTP I worked for in Western New South Wales had a big issue with this. We had high failure rates for our registrars, and a high proportion were trained overseas. And we saw a necessity to actually, at the first registrar workshop, actually do an assessment of people's communication when they were in that interactive situation, and tell people that we thought there was going to be an issue and offer them help from there on, rather than at the college pre-exam workshop. And we had an in-house person who was tasked, just that was their whole job, was to try and help people with their language skills during their training. I don't think that was an overreaction. I think that's the scale of the problem.
So we've just got 3 quick people, Lina, and Lachlan Fieldhouse has got some resources to show you afterwards. Thanks.
Hi Lina, Genevieve Yates here. Thank you very much for your pitch talk. It's an excellent topic. I suppose I just wanted to mention that it's really important to differentiate pronunciation problems from other communication problems, and I note that you have done that. It's so common, I find, that we just tell registrars or IMGs that aren't registrars, oh, you just have poor communication, or just these global things. Well, there are so many subsets of that. And I think that while pronunciation is one of the most important, it's one of the hardest to change, and probably got less success at making large-scale changes, but as has already been mentioned, watching Australian television can actually be quite helpful, much as it seems a bit strange. And I think the slowing down, etc. We have had a couple of registrars who have worked with speech pathologists, speech therapists, with some success. Not so much at changing their pronunciation, but slowing them down and getting them ways of checking with patients to make sure they are being understood. But it's a great project. Thank you.
Thanks, Genevieve. Here, and then that gentleman over there will finish.
Hi, I just had a thought. Sorry, I don't know if it answers your questions. Have these registrars been videotaped? So to videotape and try and analyse that and give that directed feedback, and then do the intervention and videotape again to see has it made a difference?
Have a think about that while I go to this last guy down here.
Thank you. It's taking a protest for me to have a speak. I'm Cosmos Ekezi, a GP supervisor, Central Coast. I think it's a good project you're doing, but I guess we need to put this in a proper perspective. The people we're talking about actually would have sat and passed an English requirement test. So to suggest they don't have a good grasp of English would actually be offending to some of them. And they would have committed large sums of money to invest in that English test. At times, they might have done it a couple of times. So we need to go to the basics and have some understanding with these people. Secondly, language is a very cultural thing, and medicine in itself is also very cultural and situational. So when these people come to Australia, they're adapting to a very difficult circumstance. I mean, if I took you to Spain and made you to practice in Spanish, I would wonder how many years it would take you to start writing prescriptions. So they are trying to do an incredible job. The question should be, how can we address these issues? What support processes should we put in place for these people? And I think we're not doing enough. I had experience where friends of mine went to Russia to train. In Russia, before they got into formal training, they had what you call the language transition period, which was a 12-month period. And this made them competent. What are we doing in Australia with these people? We set up an English testing process which they go through and pass, and that should make them competent and regarded. But they finish it, what do they get in return? We refer them to speech pathologists. we make them sick people, people with disordered speech, when in essence they need linguistic support with somebody who knows linguistics. So I think we've got to match expectations to reality and talk to the people and really understand their problem. It's only when we do that you can get a significant uptake in the program you're doing. Okay, thank you.
Thank you. A lovely comment about recruitment for you. Lina. So, Lina, I hope you got something from that. Yes, I want you to do that, and then we're going to wrap this up. That's great.
Thank you. I'm an IMG myself. I'm an overseas trained doctor and all respected doctors, and I know that this. I think that this is going to be a sensitive issue for some, but this is for the registrars. This is to support the registrars because it's been an issue for them, and registrars come to me and I'm going to help, and nothing has been done about it. So I decided that this is something to do I don't know, just some kind of help support the registrar, and this is all on and off the basis. We're not forcing any registrars, but we know that it's not just the communications with their supervisors and patients. It's just where we are, these placements have become very competitive, and we have to go through an interview process. And again, the language becomes a problem. When they come to the exam, the language is a problem. So the problem is there, and I agree that it has to be approached, in a sensitive way for some doctors, but it's a problem, and if the registrars need to be supported, they should have options. That's what I'm suggesting, that this is an option if someone wants help or needs help or asks.
So speaking of help, Lina, did the pitch talk help you?
Very much. Thank you, John. Thanks, everyone.
Yeah, well, you were all great, weren't you? Yes, thank you. So what do you think of pitch talks? Did we all get to help? Are you all channeling your inner Billy Joel just like me? Can't do anything more because we're doing it all for Lina. Huh? Yeah, that's it. I'm old, but I can't sing, but it doesn't stop me.